First of all, good night to everyone. Thank you for being here. I would like to thank brightbot.com for sponsoring this webinar. For those of you who don't know me or have never been on one of my webinars, my name is Dr. Jaime Meza. I specialize in emergency medicine, also in preventive medicine and chronic conditions. Throughout the presentation, your microphones will be muted, but there will be some time at the end for you to ask questions, and I will be very happy to answer those questions. If you have further questions at the end, you can go into brightbot.com and record a video question, and me or somebody else will reply with a video answer for you. I would like to remind everyone that this webinar and all my webinars come from my personal and medical experience, but they do not replace a medical consultation. So let's begin. Today we're gonna talk about one very important subject, which is breastfeeding and breast milk. I think there are certain things that we all need to know, and this is a very interesting subject. First of all, I always like to mention some numbers at the beginning. Around 80% of Americans, American mothers, ever breastfed their children, and this is very, very interesting because that means 20% never did. So now we know there are some mothers that never breastfeed. Of course, we have to be fair and know that most of this percentage was because they had certain conditions, or the baby had certain conditions that didn't give them the opportunity to breastfeed their children. But of course, that is a big number anyways. And the ones who did, 50% of the women only breastfed their children till age 6 months. So that's also a very small number. And that percentage continued to fell to 30% when they reach age 1. So that means we are seeing now a trend of a problem with breast feeding. And if we see the numbers of exclusive breastfeeding, you'll see that those are even worse. Only 40% were breastfeeding by 3 months, so that those numbers are really bad. And I guess that's the whole purpose of educating parents about the importance of breastfeeding. So hopefully this is going to be some help. What are the benefits of breastfeeding? There are a lot. Obviously, I'm going to mention like the most common ones and the biggest, but there are too many to mention. Of course, the first, I think in my experience, it's the bond that it creates between the mother and the child. That I think it's the best benefit, and it's very, very important psychologically for the children. The second most important one, I would think, is the immunological benefits for both mother and child, but obviously it's better for the child. Breast milk contains immunoglobulins that are proteins that help the body of the child defend against certain viruses and bacterial infections, and are extremely, extremely important and one of the best benefits of breastfeeding. Of course, the nutrition that it gives to the child, it's not compared with any formula or any other type of food. Of course, that's why as time goes by and we know more about breast milk and breastfeeding, we recommend more, to do it more. Back in the 50s and 60s, we were maying that maybe the formula was better, contained more nutrients, but now the more we research, the more benefits we found, nutritional factors and immunological and many other things. There's another benefit, and this is for the mothers. It helps them regain or lose weight faster, and also be healthier. this is something that most women don't know, so they're worried about losing the pounds they gain in their pregnancies, and breastfeeding is one of the best ways to do it. And this is a little bit controversial, but in my opinion, it is a good a benefit, anyways, and it is it helps with birth control. It is contraceptive. So if used correctly, of course, there has to be certain specific conditions for this to be a good contraceptive measurement. But of course, it is a good advice, especially for women who are not able to get any other, like the pills or the depot shot or something like that. What is the composition of breast milk? Of course, basically the basic composition mostly is water. It has a lot of fat and has proteins, lactose, which is a kind of sugar, and some other components, including, like I was saying, proteins like immunoglobulins, which are for the immune system. There is one very specific component that everybody talks about in commercials and when you're looking at commercial formulas, baby formulas, which is the DHA. Well, that's part of the fat. It's a component that makes essential parts of the brain and brain cells. It is part of the it's omega fatty acid. So in case you were wondering, like every commercial and in the formulas it says it contains DHA. Well, it is a natural component of breast milk, and it is a fatty acid, an omega acid. It is also present in some other foods like fish, as well as the other omega acids. And it is important to know that at different stages in the, well, in the pregnancy, but not only in the pregnancy, but after it, the composition of the breast milk changes. In the first hours, in the first few days, basically the first 4 or 5 days, there's the milk is called the colostrum, which contains a lot of fatty acids, and it's very thick milk. It's not produced in big quantities, and that's a reason why the mothers might complain that they're not producing enough milk. But it's because this milk it's high, it's very rich in certain nutrients, so they don't have to produce as much. And then as days go by, probably after day 4 or 5, they start producing a more kind of light milk, which is the foremilk, and then it continues changing. Like a very amazing fact that I want to share with you is that the colostrum and the breast milk of mothers of premature children changes in composition depending on how premature the child is, and I think that's amazing because when we in the neonatal intensive care unit are dealing with premature children, we we need to change the formula every day depending on the requirements and the weight of that premature child. But we do numbers, we do calculations, trying to give the best thing for that child. But it's amazing that the body naturally tells the mother what, I mean, like the breast, what milk to produce. It changes every day, and I think that is amazing, and that shows how important breast milk is and breastfeeding. One of the most common questions that I get and that we get is, when should breastfeeding start? Now, the recommendation is it should start 1 hour. I mean, as soon as you can in the first hour after birth. Maybe not immediately. Of course, there are certain things that need to be attended first, but in the first hour, the first breastfed should take place. And now hospitals that most hospitals at least should have policies to ensure that not only the skin-to-skin contact after birth, but the first breast feed after in the 1 hour period. So this is when it should begin. And when should I stop breastfeeding? That's another question, and I guess this is also a little bit controversial. I would say, and when you read about it, now the current um, papers about it say that it is a agreement between the mother and the child, and I guess that is a very open answer, because that could be 4, 5, or 6 years. Of course, we have to know that the recommendations, at least made by the World Health Organization, uh, are based on requirements, on nutritional requirements. So basically, what we definitely know is that exclusive breastfeeding, which means that your baby is only receiving breast milk, nothing else, not even water. Exclusive breastfeeding uh, should be given until, I mean, for at least for the first 6 months. That is an answer that is more, a question that is more easily answered. And we know it should continue till age 2. But of course, there's where the controversy is. Some movements now are saying that you should continue till age 3 or 4, or until your child wants to. And of course, there's no literature that is against that. But we definitely know that the nutritional factor of the breast milk, it's not as good as, I mean, after age 2. Then why the World Health Organization recommends age 2? Because we have to know that these recommendations have to be followed by every country in the world. And of course, not every country is as developed as the United States. So of course, in some places in South America or Africa, the children are dying of malnutrition. So of course, the only food they can get sometimes is breast milk. So of course, for them, it's good to continue till age 2 or farther. So this is a question that I will leave open a little bit, because there's nobody that can tell you have to stop at age 3. I can tell you the recommendations is at age 2, but of course, in this setting here of North America and developed countries, after age 1, I mean, after 6 months of age, you can start complementary feeding food, sorry, and then after age 1, we hope that your child is already eating everything that you are eating, of course, in a small portion, but taking that into account, then breast milk shouldn't be necessary by then. How many times a day should I feed my baby? Is another question, especially for first-time moms that are pregnant and they want to know what to expect. Of course, the answer to this is that it depends on the age of the baby. Of course, now we are trying to follow certain policies and certain recommendations about feeding on demand. That means every time the baby wants, and that is one of the most difficult things to actually know, because another question would be, how do I know my child is hungry? Because that's actually a little bit difficult to know. What I can tell you is that usually newborns feed every 2 or 3 hours, and it's a recommendation actually to wake them up. That is very uncommon. That is very common to happen, that mothers don't wake up their newborns because they think well, they don't need to eat when they're sleeping. And now we know it might cause hypoglycemia, which is very low blood sugar. So at least when he's a newborn, that means the first month, he should be, and I think more than that, probably the first 2 or 3 months, he should be waking up to eat at least every 2 or 3 hours. When the baby grows up a little bit, 3 or 4 months, then it will start eating every probably 4 or 5 hours, and then so and so. Of course, like I was telling you, uh, after 6 months, you should start complementary food. So that means the basic feeding will still be with breast milk, but then as you introduce different foods, then those intervals will change and maybe very different one child to the other. Um, how long is a normal feeding session? Very, very, very common question. Of course, that also depends on the mother and the child, but usually for newborns, it's between 20 minutes and 45 minutes. Uh, how to know? Well, there are certain signs. I guess every mother knows or gets to know his child, but of course, there are certain signs. For example, when the baby is relaxed and the hands are no longer fisted, when he is not is sucking no more, and then you might see he is getting tired. He's not very interested in feeding anymore. What you need to do in that case is burp the child and then use change to the other breast. Maybe he will start feeding again, or he will simply not. Then that's normal. It's normal to some babies to be satisfied with only one breast. Some others will drink a little bit from the other, and then the ideal thing is to start 2 or 3 hours later with the alternating breasts. Of course, this might take a little longer if we're talking about premature babies, because the suction is not well developed with them. So of course that this might take a little longer. Can I breastfeed if I am sick? This is a very important question. The answer is yes. Of course, this is for most cases. It is safe to breastfeed while having a fever. That's something I can tell you. It's kind of a myth that you cannot do it. It is okay to breastfeed while you have mastitis. Mastitis is an infection or inflammation of the breasts, and it is quite common among breastfeeding mothers. But now we have studies that tell us that it is actually very good to breastfeed, not only for the child, but of course it might help you unclog certain ducts that may be clogged with milk or something else. So it is safe to do it. It is also safe to breastfeed when you're Hep B or Hep C positive. You may do it. There's no problem. There's no problem to breastfeed if you have a flu or a cold. And certain exceptions to this rule, or at least when the answer is yes and no. For example, when you have certain skin lesions, very specifically for herpes, that means the baby shouldn't get in contact with that part of the skin. If your other breast is okay, then he can breastfeed from that breast without any problems. If you have lesions in both, which is not common but might happen, then you can express the milk. So just because the virus is not in the milk, but it's only on the skin, so it can still be used in that way. Is there any reason why a mother should not breastfeed her child? Well, yes. Of course, that might sound a little contradictory to the question before, but of course, there are certain exceptions to this rule. If the mother has been infected or it's infected with HIV, yes. And of course, if you read about it, you'll find that for some other countries, this recommendation is not necessarily true. And it's the same thing like I was telling in certain under developed countries. Um, People die more of starvation than HIV. So the recommendation there would be to breastfeed without any problem. Of course, here in developed countries, definitely you shouldn't, because HIV virus is present in breast milk. If you're taking antiretroviral medications for HIV, for example, or maybe Hep B also, it's not that you cannot, if you have Hep B, as I said before, but if you are taking antiretroviral medications for that, then you shouldn't. If you have active and treated tuberculosis, the same thing, because the bacteria causing tuberculosis might be present in the breast milk. If you have T-cell lymphotropic virus, also, uh, if you're using or you're dependent on illicit drugs, and most drugs, or at least narcotics, might be treated and but they pass to the breast milk. So of course, cannabis, marijuana, cocaine, they all pass through to the breast milk. So of course you shouldn't. If you are taking certain, not every chemotherapy, but some chemotherapy, you should not breastfeed. And of course, certain radiation therapies. So these are the actual things or conditions that tell you that you shouldn't breastfeed. They're not very common, so most moms are able to do it with any problem. What is the correct technique to breastfeed? There are several positions to do it. These are the most common ones to do it. Of course, the one that I would like to talk about more is the lying down position, because it's the one that I am afraid the most, because you have to be careful if you choose that position to breastfeed your child, because I've had experience with moms that fall asleep in this position and when they're breastfeeding their child, and they roll over and they might asphyxiate the baby. So just be very, very careful. Of course, they can fall asleep in other positions, but the risk of actually causing asphyxia are lower. And by the way, another benefit, one of the many benefits that I didn't mention about breastfeeding is that it reduces the death infant syndrome. It reduces a lot, so it's a very good measure. Of course, now I've encountered many moms that have problems starting to breastfeed their child because they don't know like the exact grip they should have. Well, this is an image that tells you, and I want you to pay attention to the upper lip. The upper lip needs to be rolled almost touching the nose, because and see that the mouth is covering the whole areola of the breast and not just the nipple. It has to be, because the nipple has to be very down on the throat of the baby, and that is one of the most common reasons why babies do not breastfeed, because moms get frustrated because their child are not sucking correctly, and this is a process as the baby breastfeeds, the more milk is produced, and then the baby sucks more, and then more milk is produced. So it's a cycle. But if this is not done correctly the first time, then it will cause many problems. So if you do it correctly, then this will ensure that the rest will be very easy. Preserving breast milk, this is something also very important. These are some recommendations of how you can store and preserve the breast milk. And this is something that is now used more and more, and now there are breast milk banks, and there are services for mothers that are not able to breastfeed to get express milk from somebody else. So these are good recommendations of how to do it. Just a room temperature, the breast milk lasts about 4 to 6 hours. If you put it in the fridge, it will last for about 8 days. If you freeze it, it can last from somewhere between 6 months to a year. So it's I think this is something you should really take into account. Of course, it's not very usual to freeze milk for 6 or more months. This is more for banks, but at least for moms, keep it in the fridge. It's a very good recommendation. Okay, this is one subject that I would spend many hours talking about because I'm pretty sure there are many questions. So I will start listening and maybe we'll have a part two because I know there are many things we can discuss about it. So now it's time to ask questions. Thank you very much.
Somebody.
Dr. Jaime, did you say breastfeeding as part of contraceptive?
Yes. Exclusive breastfeeding, that means that your child is only getting breast milk and that you are breastfeeding more than 7 or 8 times a day will ensure that the breastfeeding is a contraceptive measure. It's effective if you do it this way more than 90%, so or more, 95%. So it is very close to the pill or to the depot shot, and definitely quite better than condoms. So it is if you're exclusively feeding your child with breast milk, it is a good contraceptive measure.
Okay, thank you.
Just to follow up on that.
I was told after delivery that because of your hormones that you are more likely to get pregnant even if you are breastfeeding.
No, definitely not. Of course, we have to know that it takes a little while for the body to actually restart the whole menstrual cycle and to start ovulating. But prolactin, which is the hormone that gives the signal to produce breast milk, it's contraceptive. So there's no way. What happens is that now, as you saw in the first numbers that I gave, it's very rare to actually exclusively feed your child because now mothers, when their babies are 2 or 3 months, they start introducing other food, and then there are certain times in which the prolactin levels fall a little bit, and then it's not as effective. So it's not that you're more fertile, but definitely this won't be a good contraceptive measure if you're not exclusively breastfeeding.
And say you are breastfeeding exclusively, you are not menstruating during that time period that you're breastfeeding. Is that correct?
Yes.
So then how will you know, since you said that it's only 90% effective, if you become pregnant, since you are not menstruating and you're breastfeeding exclusively, you said there's still a 10% chance. Wouldn't that be dangerous as well? Because, breastfeeding does stimulate the production of, what you just said, the hormone prolactin. So couldn't that cause like premature labor? Say you do become pregnant immediately after having a child and breastfeeding?
Well, definitely, it would make difficult for you to know if you're pregnant, of course. But then if you compare that to other measures that you can take, for example, the alternative, which is the depot shot, which is basically the only other thing you could use. Well, I mean hormonal. It's the same because you're not going to be menstruating anyway. So yes, definitely it's difficult for you to know, but I wouldn't say it's dangerous. If you ask me what method do I prefer, of course I do prefer depot shot. I do think it's more reliable, but for certain mothers that have no other way of doing it, I would recommend to do it at least, because of course any pregnancy in the consequent 2 years after birth, it's dangerous. It's not recommended.
Jaime,
Yes.
sometimes in breastfeeding, the mother will continue to breastfeed the child, or there's no nutritional value. The child is just nursing just for comfort. It's for psychological. It's like for the mother and the child, because the mother doesn't want to let go, and the child is using it for a comforter as such. What do you recommend in those cases as far as weaning the child, because they're not getting any nutrition, but it's just like for comfort?
That's why I said it's kind of controversial, because of course that's something that depends on the mother if she's okay with that or not. Now it's kind of a taboo to talk about this and to say, I mean, if you go on the streets and you maybe see somebody breastfeeding a 4-year-old, maybe that would be something that will definitely call the attention. But if you read, and I read about it because I wanted to know, there's actually not a scientific recommendation to actually tell us that it is wrong to do it. It became like a social thing, but there's no really papers that tell us it is bad to do it. We or many doctors say that it doesn't have nutritional value, but now we know that there is a little nutritional value. Of course, there has to be a time where that has to stop, and because animals stop at a certain point, so that means we have to do it. I'm not really sure what age to do it or what are the best things to stop. I guess it's just when the mother is really convinced that the baby should not do it, of course, at least after giving 1 year, then it is okay to do it. But if the mother is not convinced and she still wants to do it, then she will continue. And that's the biggest problem, of course. You see them and that's a way they use to calm when the child is crying or when he wants to go to sleep. So that's kind of manipulation from the child. But if you let your child manipulate you, then that's the big problem. So I don't know if there's a big way. Actually, I don't know the answer, but I guess that's something the mom has to figure out.
All right. Okay.
How do you recommend stopping breastfeeding?
How do I recommend what? Sorry.
How do you recommend to stop breastfeeding?
Well, I think it should be gradually doing it. I think you should talk to your child and let him know that you're gonna stop, that you're gonna replace this with something else. Of course, now bottles are not recommended because that's a very common mistake that they replace the breast with bottles, but then the child becomes dependent on those bottles. So it should be gradually, not doing it from one day to the other, and always talking to your child and always knowing that he will try to manipulate you either by crying or doing a tantrum. So just be sure to tell him what you're doing, why you're doing, give him some options like first you're gonna feed him for less time and gradually wear that off, take him off. But
Physiologically, say if you don't stop producing milk, what should you do then?
if you don't stop producing milk, well, you can do certain studies after that, but there's some medications that you might take if this takes long. Like, I guess it's normal for a couple of months to still produce milk, but if you continue to do it, you can go to your doctor and probably he will give you certain medications for that. Not all the time, but it might help to take some medications. Some women actually request the medications because that's the way they want to stop breastfeeding, and I don't recommend that because, of course, that means you are obligating yourself to stop and not because you want to do it.
Dr. Mesa,
Yes.
what would you say to a mom? She's home for, say, 6 to 8 weeks after the baby's born. She's breastfeeding.
and she goes back to work and she's just not able to express her milk at work. She'll maybe do it when she's home at night. And it may not be enough to feed the baby during the day from a bottle of, for that, the milk that she expressed. What would you suggest that she does then?
Well, it's a difficult question because the only the answer that is logical would be to mix some formula. I guess the ideal scenario would be for her to express the milk while she's at work, to request permission, and that in an ideal world should be something acceptable. But of course, if there's no way she can do it and the breast milk is not enough, she would have to use formula. But well, that would be a shame, of course. But I know we don't live in that ideal world. Of course, now there are breast milk banks, and she might be able to use one of those banks. That's another option. That would be a good option also.
Okay. I have another question.
Yes.
What about if the mom has chicken pox? Would she be able to breastfeed the baby?
No. Actually, chicken pox it's varicella virus. So like I was telling you, varicella is from the family of herpes virus. So it's contagious in that phase. So no, she shouldn't. Actually, she shouldn't be with her baby for that time. So yeah, that's another contraindication for breastfeeding. But just for that time, at least for I think about 10 or 12 days, when she has active lesions on the skin that can, it doesn't spread through the skin. It's actually respiratory, but the lesions tell you the time the disease is contagious, so she shouldn't.
But she would be able to do it after 10 days? Or?
Yes.
Okay, thank you.
You're welcome.
Dr. Mesa, what
Yes.
about support groups? How are they in existence, or do they have a lot of them for people that maybe want to breastfeed and they need advice? Like, for instance, when you said how to hold the baby's head to make sure that they're nursing properly. Do they have groups that still exist? I knew they used to have a league. I know they used to do that kind of stuff. Do they still have groups that do that type of support?
Yeah, definitely. There are groups. I don't have one in mind right now, but I know there are several groups that not only teach and help women breastfeed, but also help them get the express breast milk. Or if you are interested in doing it, they help you contact somebody to pair so you can share the breast milk. Of course, every hospital needs to have a policy and needs to have a specialized group of specialists in breastfeeding. That's actually a medical specialty. So also that's another resource that can be used, of course. And every hospital should teach and give instructions to the new mom of how to breastfeed and all of this that I'm explaining. That's what should happen. Yeah.
Okay.
Dr. Mesa, what happens then to the milk if the mother has the chicken pox, like you said? Does she express that milk and get rid of it, discard it?
That's a good question. I'm not really sure. To be honest, that I don't know the answer to that question. I will research. Probably this is a good question for a video question, and I might research about it. So I'm not really sure if the herpes virus is going to be present on the breast milk. I would say no, and it would be safe to express the milk and give that to the child. But I'm not 100% sure, so I would have to research on that.
Okay, thank you.
Dr. Mesta.
Yes.
I've got a question, sir. With regard to the rule about a mother not breastfeeding when she's HIV positive, would that rule also apply if the baby was born HIV positive?
No, no. In that case, that rule wouldn't apply, of course. Um, but well, yeah. There's no. The only thing that there are two types of HIV, HIV-1 and HIV-2, and we try not to mix those two viruses. But since the baby has the same virus that the mom has, then that problem will no longer be there. So I guess she can still breastfeed if he is already positive. But of course, we would have to make sure that he is positive also. So it would take a little bit of time.
Thank you.
I have a question.
Yes.
What are the effects? You mentioned that a couple drugs interact with breast milk, like antiretrovirals. What about certain psychiatric drugs, like not illicit drugs, but stuff that's prescribed? How would a breastfeeding mother have to take that into account?
I guess each medication is different. It has its own indications and contraindications. What I can tell you is that all the medications go and pass to the breast milk, all in different quantities and concentrations. Of course, some of the medications need to be taken at a lower dose, and some medications need to be taken at certain hours to reduce the concentrations that are going to be passed to the breast milk. So, of course, it's very, very different with every different medications. There are some ones that will not affect the child as much as others. Regarding psychiatric medications, I know some of them are contraindicated in pregnancy, but not necessarily in breastfeeding. I'm not sure. The only one that I would say might be totally contraindicated, and I'm not really sure, it might be lithium, because it might get into a lethal dose in breast milk, but I'm not really sure also about that question, because it depends on every medication. Okay. Well, thank you. Oh yeah.
I've got a few questions if you don't mind.
Yeah, go ahead.
Great. The first question I have is, let me just take care of the housekeeping here. The first question I have is, for how long will the child have immunity after the mother stops breastfeeding?
Not that long. The reason why there's transfer of immunity with breast milk is because it contains, well, the main reason at least, contains a protein that is called immunoglobulin A, which is an antibody that passes through the milk. That antibody is not going to be present for a long time, probably a month or so. Of course, if they are continuously breastfeeding, that's going to last for that year or more. But if they stop, that immunity is going to wear off in about like a month or 2 months. It's not going to last very, very long, actually.
What happens if the mother is trying to breastfeed, but her milk supply hasn't come in? What would you suggest?
The most common cause for that is the technique. She should try to improve her technique or consult a breastfeeding specialist, because as I was telling you, this is a process that requires feedback. It requires the child to be sucking in the areola and nipple for the brain to get the necessary stimulus to start not only producing the milk, because the milk production is controlled by the prolactin, but the actual ejection of the milk, which is controlled by another hormone, which is the vasopressin, and that is released when the child sucks on the nipple. That area releases the vasopressin. So It is very normal for mothers to think they're not producing enough milk and get frustrated, but I would, as first, I would say just to calm down, be in a comfortable position, make sure that the mouth is correctly positioned over the nipple and the areola, and just give it some time. If not, then of course they should consult with a specialist, because the problem might be, and it's almost always very easily to correct, and not to fall into the frustration and then start formula, because then it will be very difficult to restart breastfeeding.
How can a mom know if the baby's getting enough nutrients, though?
Well, the best way to know it actually is the weight gain. It is very important for moms to know that the first week of life, babies actually lose weight. So it's not that you should be worried about. But after that, probably the next week, he will be again at the weight that he was born with, and then he'll start progressively gaining weight, and that is the best way to know that he's actually getting nutrients. Of course, the only way to know it 100% would be to measure that in blood, but of course it's not worth to do it. Now we recommend vitamin D for babies, because we know it is a nutrient that they don't get the whole what they need with just breast milk. So that's the only thing I would recommend. For some babies, also after certain tests, maybe iron will also be necessary.
Just my last question. What happens if a mom has a clogged milk duct? How can she remedy that?
Well, that is also a very, very, very common, something very common to happen, and it might lead to mastitis. But usually by doing certain massages with some hot or warm towels or compresses, it will unclog just by doing some pressure from up to the nipple until it unclogs. That's basically what they do, and it's very effective. Of course, there are some cases in which it never unclogs, and then it leads to some other problems. But I would say in 80-85% of the cases, it actually unclogs just by doing certain massages with warm towels.
Thank you very much.
Okay. Thank you everyone for your attention. I hope you enjoyed it and you learned a little bit more. I'm sorry to those questions that I couldn't answer. I promise that I will try to answer them if you leave your question in brightbot.com. And hopefully we're going to be able to meet again in my next webinar next Tuesday. So have a very good night.